We will now see grief or bereavement. Grief can occur either from the news that a physician gives to the patient about a terminal illness or something, so on oneself or on other persons, so the sadness associated to the loss of a loved one. So the stages of this include shock and denial, then the anger, bargaining, depression, and acceptance. So this doesn't need to occur in order. That is, the patient can be in shock after the physician tells the news either of that the person has a terminal illness or that some loved one died, could react with shock and denial and certainly believes that it's not happening, that the patient doesn't have the disease, etc. Or the patient is angry and reacts, and this could be a little bit of displacement. So the patient is angry because the person has the disease or because that loved person died, but is angry with the physician because the physician gave the news. Depression and acceptance, they are very clear. Now this doesn't need to occur in order. For example, the patient at the beginning can have anger and then depressed, or first the acceptance and then gets very angry or something like that. This can occur in any order. There is no order that needs to be followed. Now this usually occurs in adult patients, not in children, because they don't realize many things, but we could also see this. Now this usually lasts for 2 weeks. But other symptoms include guilty. So if there's a couple and one of they are in the car and one of them die and the other don't, the person that survived feels guilty about the death of the other person, so feels extremely guilty, and so this could be a complication. This is seen usually when one of the person dies and the other don't. This is very complicated because the patient feels extremely guilty. Now the usual is that it lasts for 2 weeks, but can last for 6 months to 12 months in a adult. In a child, up to 6 months, because if it persists, then it can meet criteria for major depressive disorder. Now, things that will make us think that the patient has major depressive disorder as opposed to grief is either if the patient has psychotic episodes, or the patient has the psychomotor retardation is severe, if the symptoms are lasting more than 2 weeks, if the patient has severe function impairment, if the patient has thoughts of dying, or if the patient feels guilty. So in grief, the person can have thoughts of die, but that are just related to that wants to join to the couple or to the other person, something like that. That is normal. But if the patient feels guilty and is very interfering with the function of the patient, then this is complicated grief, or you can think it as major depressive disorder, and then needs to be treated with usually selective serotonin reuptake inhibitors. And it's very markedly this, because this occurs when the stressor occurs. The stressor is usually the death of a loved one. This is a very awful situation. The the treatment for this, if it is just grief, then it is just reassurance. Also, the patient can have like hallucinations that is just feels that the dead person is talking to them, that is not interfering with their life. There's no need to do anything at this normal grief. But if the patient feels extremely agitated, guilty, then this patient can feel very bad, can commit suicide, and so we need to treat these patients in the very moment. So it's very important to know the difference between grief and complicated grief or major depressive disorder. It is major depressive disorder, usually with these features, or if it lasts longer than 6 to 12 months in adults or 6 months in children.